Welcome back. Today we'll be discussing about the changing concepts in the public health. So, let's begin. The first is disease control phase from 1880 to 1920. Then it comes the health promotional phase from 1920 to 1960. Then we have the social engineering phase from 1960 to 1980. And finally, we have the health for all phase from 1981 to 2000. So, let's begin with the disease control phase. So, basically, during the 19th century, the disease control phase was a matter of aim at the control of the man's physical environment. Example, water supply, sewage disposal, etc. These measures were not aimed at the control of any specific disease. However, these measures vastly improved the health of the people due to disease and death control. It was largely a matter of sanitary legislation and sanitary reforms aimed at the control of man's physical environment. So basically, it did not aim about any control of any specific disease. Rather, it took into the aim about largely the matter of the sanitary legislation and sanitary reforms. So the next was the health promotional phase from 1920 to 1960. At the beginning of the 20th century, a new concept, the concept of the health promotion, began to take shape. It was realized that public health had neglected the citizens as an individual. So, to overcome this, in addition to the disease control activities, one more goal was added to the public health, that is, health promotion of individuals. It was initiated as personal health services such as mother and child health services, school health services, industrial health services, mental health and rehabilitation services. So for this, two great movements were initiated. So those were, the first was provision of the basic health services. Provision of basic health services through the medium of primary health centers and sub-centers for the rural and urban areas. The second was the community developmental programs to promote the village development through the active participation of whole community and on the initiation of the community. The next was social engineering phase from 1960 to 1980. With the advances in the preventive medicine and practice of public health, the pattern of the disease began to change in the developed world. Many of the acute illness problems were solved. New health problems in the form of chronic diseases began to emerge. So, many of the active illness problems were solved, whereas the new health problems in the form of chronic disease began to emerge, like the cancer, diabetes, cardiovascular disease, alcoholism. These problems could not be tackled by the traditional approaches to the public health such as isolation, immunization and disinfection, nor could these be explained on the basis of the germ theory of the disease. A new factor, that is risk factor, as the determinants of these disease came into existence. Unlike the swift death began about by the acute infectious disease, whereas the chronic diseases placed a chronic burden on the society. Hence, the public health entered into new phase in the 1960s, described as the social engineering phase. Here, the social and the behavioral aspects of the disease and the health were given a new priority. The public health moved into the preventive and rehabilitative aspect of the chronic diseases and the behavioral problems. So the next is health for all phase in the year 1981 to 2000. So this phase filled the gap between the rich and the poor. Here we can see most people in the developed country enjoyed all the determinants of the good health: acute income, nutrition, education, sanitation, safe drinking water and the comprehensive health care. In contrast, only 10 to 20% of the population in the developing countries enjoyed ready access to the health services of any kind. The neglected 80% of the world population to have an equal claim to the health care protection from the killer diseases of the childhood and to primary health care for mothers, and the children. Hence, in the year 1981, the 34th World Health Assembly formulated and adopted the Global Strategy for Health for All. It led to the socially, economically productive life. So that's all. So the summary is from 1880 to 1920 we have disease control phase. From 1920 to 1960 we have health promotional phase. From 1960 to 1980 we have social engineering phase. Similarly, from 1981 to 2000 we have health for all.